option will be total knee replacement, which is a major operation which has got its own certain risks of complications, but it's a very good operation for pain relief and improving your quality of life. Hi, I'm Mr. Umar. I'm a orthopedic surgeon specializing in lower limb arthroplasty. Today we are going to talk about knee arthritis. Knee arthritis is a condition which affects the lining of the joint. Usually lining of the joint is covered with very kind of specialized cartilage, which allows the freedom of movement which we achieve in our joints, and particularly knee joint actually goes through a lot of movements in everyday activities. With time, that lining of the joint can wear off, or sometimes other conditions can also affect the lining of the joint as well, like following healing from a trauma or inflammatory conditions like rheumatoid arthritis. If with any condition lining of the joint is affected and it's not normal, it cannot actually provide us that smoothness of the joint movements, and gradually with time it will wear off and lead to the bone actually touching the bone. So in that case, actually, the movements of the joint, which allowed us to carry on with our everyday activities, it becomes more and more painful and difficult and restricted. Quite typically, patients with the knee arthritis will present in the form of pain, which will be in and around the joint, and sometimes actually it can radiate down to the shin as well. And particularly patients will find difficulty with activities of daily living, like they find difficulty with walking, going upstairs, downstairs, walking on the hills, and sometimes actually they can get instability symptoms as well, like when they walk, knee actually just gives way under them, and they do not feel confident on walking on the knee further. This condition can be very debilitating, can significantly affect somebody's quality of life and their ability to carry on with their everyday function. But we do have actually certain management options available to deal with this condition and helping you getting back to your function. So when somebody comes in with a knee arthritis, we usually start with our clinical assessment. First, we perform certain clinical tests to confirm the diagnosis. And once actually we have a suspicion of a knee arthritis, we perform some further investigations, including plain x-rays. And also sometimes we have to do some further investigations like an MRI scan of the knee as well. Occasionally we have to perform a diagnostic injection into the joint to evaluate the situation of the joint in terms of their relief of symptoms following this treatment. Combining all the information from clinical assessment and investigations help us actually reaching the diagnosis and planning for the management. Now, how do we manage knee arthritis? Typically, we start actually knee arthritis management by non-operative ways. Non-operative ways includes starting with the modification of lifestyle activities, like avoiding the high-impact activities which are causing us more pain. But if pain is affecting more or less actually all the time, then actually we have to consider use of analgesics in the form of painkillers or adding with anti-inflammatories as well. Sometimes intra-articular steroid injection can help calming down the pain symptoms, although it does not cure the condition itself. We can start using walking aids on the same side of the affected joint, which can offload the pressure on the joint. And sometimes physiotherapy rehabilitation also helps taking away the pressure from the joint and helping us going with our everyday activities. Moving forward, if non-operative ways do not seem like helping much, we can consider some joint preservation options, like some particular injections are there available now, which can help improve the lubrication of the joint to slow down the progress of arthritis. Essentially, those injections are recommended in early stages of arthritis when actually still there is some joint space is preserved. If joint space has significantly worn off, then actually we may need to consider surgical options of preserving the joint. Like there are certain osteotomies available where we realign the knee in a way it offloads the affected part of the joint. If any of these measures do not work, we have the option of joint replacement surgeries. Again, in joint replacement surgery, if only one part of the joint is affected, we can actually offer a partial knee replacement where we only replace the worn-off joint and rest of the joint is actually left alone. Usually this operation gives us an option of a smaller operating time quicker recovery and better rehabilitation. And usually after these operations, patients feel more like a normal knee they're walking on. If joint arthritis is very advanced and it has affected more than one areas of the joint, then actually option will be total knee replacement, which is a major operation which has got its own certain risks of complications, but it's a very good operation for pain relief and improving your quality of life. Again, it's a hospital stays usually 1 to 2 nights, but there will be a rehabilitation program before and after surgery to help you gain the best outcome after this operation. Quite typically, surgical pain settles down within 6 weeks, and by 6 weeks mark, we do expect most of the patients to start walking unaided without much pain in their knee. And so that from that point onwards, they can expect to start returning back to their quality of life. So they should be able to do most of their everyday function, including driving or walking along, and continue with their, most of the people can return back to their work as well.